People, how you doing? It's just after 8 o'clock. It's Tuesday, which means it's the Sports Therapy Association podcast. How are you? In case you're wondering, you listen to the podcast, then this is recorded live every Tuesday at 8 o'clock on the Sports Therapy Association YouTube channel. So if you listen to the podcast and you think, I want to be there, I want to ask our guests questions directly, I want to mix with these people who are in the live lounge, then it's very simple. Every Tuesday, just go to the Sports Therapy Association podcast, and that's where you'll see a link and you can join us. As I speak now, people are entering our live lounge, which is always good to see. When you do come in, then what I can do is I can bring your comment up onto the screen with your logo. So it's actually quite a good networking thing if you want to use a logo, or if you're Glenn Murphy, you can put up a picture from, I'm not even sure what that is. Sorry, I'm showing my ignorance there. It's from a film, I can't recognize it. Anyway, Glenn Murphy says, we have you been? Okay, Glenn's been on the bottle again. Let's just take that off the screen straight away. Nikki Mansfield is here. Hey, Nikki, how are you doing? Hello, hello. Happy STA night to all. Nikki Mansfield was, of course, here last week in our catch-up. Last week was the first Tuesday of the month. So what we do on the Sports Therapy Association podcast is on the first Tuesday of the month, we give you a chance, the common soft tissue therapist, to come up and have your say, talk about the last month's podcasts, talk about yourself. So yeah, last Tuesday, that was it. And as always, you can catch up with every episode of the Sports Therapy Association podcast by going to YouTube if you want, watching the video there. You can go to any podcast app and listening to it there, including Spotify and all those kind of places. Or you can go to the STA website, which is the sta.co.uk. And there you have all the show notes, all the links, and you can watch the video there as well. So loads of ways to catch up. If you don't manage to join us live, people are still coming to the live lounge. Thanks so much for joining us live. As always, it makes all the difference. I love it when you join us live. It's so nice. And it's so exciting as well, because I know a lot of people who join us live are going to be at Therapy Expo now in doing the maths quickly. What is it, 3 weeks or something? 23rd, 24th of November. And that's going to be happening very soon. Look, there's the cover slide for the presentation for starting the Wednesday. We'll have done 126 episodes by the time Therapy Expo comes along. And last year when we got there, it was 77. So 126 episodes. And I know, I'm thinking of the quality of our guests and thinking we've got 126 hours of that. I think by now we're probably one, not including obviously the material by our guests, but we're one of the leading CPD providers, I think, in the UK, if not the world, with all of that. Just because I'm thinking of the people who we've had on the show. So that's all there for you people. And at Therapy Expo, it'll be so nice to catch up with you people once again. And we will be talking shortly to two more speakers who are going to be coming along to the STA Theatre on Wednesday 23rd of November and Thursday 24th. I'm going to bring them up very shortly. Nikki Mansfield says, woo, the Scots are in the house. Everyone in the live lounge has been drinking at the moment. What are they handing around? No idea what anyone's saying at the moment. Jim Tipper, please, Jim, look after evening. Managed to get a free Tuesday evening, so watching live for the first time. Thanks, Jim. Very nice of you to join us. I'm sure with the guests we are bringing up very shortly, you will not be disappointed. Obviously, if you have got questions for us, anyone in the live lounge, then shoot away. That's the advantage of being live. Just hit them with some questions, make them tricky, make them squirm. Anything you want about them it goes. It's valid. It'll just be downloaded and listened to 2,700 people. So don't worry. What happens in the STA podcast stays in the STA podcast. Right. I don't think I've got any other house news to tell you. No, that's great. So, like I said, I'm very excited. Two more speakers from the up-and-coming STA Theatre in Therapy Expo. Dr Claire Minshull is going to be joining us, and James Chapman. So I think, without further ado, I shall, in no particular order, bring them up. There we go. Dr Claire Minshull and James Chapman. How are you doing?
Hello.
Very well. Hi.
Thank you so much for joining us. It's very exciting. Now, you guys are probably not. I don't know. Maybe you are. That's going to be a question, actually, because I'm very interested. Because before we have a little chat about who you are and what you do for people who don't know you, it's really interesting tonight because Claire, you've been to practically all of them, have you? Or
I don't know how many have there been.
It's been
quite a lot.
I think this is maybe number. I think it's number 10. I think maybe the 10th anniversary. I think it was 2012.
Is it? Not quite 10 then. Not quite 10, but not far off.
I'm going to ask you later on whether your expectation of what's going to happen has changed or not, or something like that. It'd be interesting to hear. Because James, it's your first time, isn't it?
It is, yeah.
Which is fantastic. You never forget your first time. I'm so looking forward to joining you and you being there, because we've spoken before on the podcast, and I'm really excited that you said yes, because it'd be wonderful to have you there in the flesh with people to talk with you and listen to your presentation. So for people who don't know you guys, maybe Claire, if you can start. I'm imagining, like we said before, imagine somebody doesn't know you, elevator pitch, 1 minute until you get to the top. I know it's tricky with someone of your age, I don't want to say age, but someone of your experience.
My age, yeah.
How are you going to tell people? Soft tissue therapist, who is Dr. Claire Minshull and what do you do?
What's your name and where do you come from?
Exactly.
Isn't it? So, nutshell, my background is in exercise science and rehabilitation. So that's what my PhD is in. Former academic, still research active. I run Get Back to Sport, which is an education and training company for clinicians and therapists, anybody involved in rehabilitation, really. And it bridges that gap between, I guess, performance and, oh, look at that, magic. Performance and elite sport, really, and what we know in that arena, and translating that into rehabilitation settings with, things that can really accelerate practice for very little modulation and change in your rehab and what you're doing, or indeed training, actually, too. So that's what I really enjoy doing. A few other things as well, but that's essentially what I do. So still research active, and I'm absolutely thrilled to be able to now share my knowledge much more widely to practitioners who make the difference.
Fantastic, and that's really important, because I mean, you've been doing it for a while now, but it's become really topical. I mean, it's a good thing that researchers are crossing that divide between the academic and what you actually do in clinic, because before there was quite a kind of crowbar separation, but you've been doing it for a while. But it's nice to see. I think there's some other people now are thinking this is what we need. This is the secret to success. Let's close that gap. Let's convert the research to something that can be done practically in clinic. So we're very lucky to have you along, and we appreciate you coming on to the clinic. It's great. Can't wait. If you haven't, people listening to the podcast, you won't see what I've just brought on the screen. I'll bring it up in a full here. So the website is getbacktosport.com. And if you go there, there's loads of information on there if you're interested. And you should be in what Dr. Claire Minshull offers. Go to getbacktosport.com and have a look through the website. Loads of courses and information. Everything and anything to do with strength and conditioning, and obviously it's really important and valid for soft tissue therapists, because it's often a part of therapy and treatment which isn't really either taught at all or isn't expanded on enough in the courses you do. It's kind of mentioned 3 sets of
yeah, exactly, and it's taking that further. So every interaction that you have with somebody, whether you be a soft tissue therapist, a physiotherapist, a medic, being able to optimize that and getting somewhere close to what optimal is will make profound differences in current practice, which, like you said, all these things are not typically taught. So it's really important to disseminate this to you change people's lives rather than you kind of changing sport performance. And I think some people view that absolutely more valid than sport performance, but it's has the same level of validity in my mind. Absolutely should be doing these types of things using best practice.
I think I've seen a few times this week, and it's just as I get older and I see it more often, I don't even use the word myths anymore. I don't like it. I used to 10 years ago. The myths we see in running, the myths of gait analysis, the myth of overpronation, but I still see a lot of people doing it now. It's become a trend now on TikTok, hasn't it, to put your head in front of the video and start slagging off everything else you see. And personally, I don't want to be a killjoy, but in the beginning, maybe it was interesting. But these people who are slagging off the people behind them, I'm sure 5 or 10 years ago, they were the person in the video behind saying those things. I just find it's a little bit jumping in your soapbox.
Yeah,
and in strength and conditioning, we talk about myths, but it's not that, isn't it? You need to learn the basics and then you build on it.
Yeah, exactly. I don't know, that we can better our understanding. I think that's the way to, I think, probably view it. And I think everybody can. I can still better my understanding on a heap of things. And once we understand that, then then we're able to translate that, or what I aim to do is and help you translate that into clinical practice. And that's what's missing. So, we evolve as a research community. So what was done 20 years ago may still hold true or may not still hold true based on that process and that scientific line of inquiry. And that's a natural evolving of evidence and, kind of science. The thing that's lagging is the integration of that into rehabilitation practice. So we've known about many things in the sport performance arena, like optimal strength training, optimized, using the cross-education effect, thinking about muscle damage and how to mitigate that. And all these things present in a rehabilitation setting. We are exercising, and often to quite intense levels, given that people are previously deconditioned or they've been inactive because of surgery, whatever. So it presents a similar level of exercise stress. We're dealing with the broadly same musculoskeletal system, same ways that would respond to training versus somebody who's doing it for a living. So these types of things are absolutely pertinent. The difficulty is, and I think some of the lag has been some of the interventions are quite challenging. And, we've talked before, haven't we, about how to optimize strength development. It's very, very heavy weight for very few repetitions. And there's a fear factor associated that when you're dealing with individuals who have got an injury, who are in pain, who are older. And I really understand that kind of do no harm kind of approach. However, and I think that's one of the reasons why there's been this lag and this gaping hole between what's best practice and in kind of sport versus what we can do better in rehabilitation. But you can view it from the other way, which almost I view it as is, if we know there's a better way, it's almost unethical to not give that to people who need it most. The reliance upon us is to solve that equation. And how can we present that when it's clinically appropriate, this optimized exercise stimulus to rehabilitate whatever it is, strength or power or, non-contractile tissue better. And that's where the difficulty lies. So it becomes an issue of changing the exercise parameters to modulate or to accommodate the symptoms and or clinical issues. And that's something that I absolutely love doing. So that's a relief. But yeah, I think, there's a lot to be said, I think, in that domain.
But yeah, evolving. And I know a lot of people from the STA, obviously I'm kind of close to them, but I know a lot of people have done your courses, and the one thing they come back with, and you can hear it, listen to you now, is just your passion for the subject. You love helping other people, help people, and then also seeing the benefits to the people themselves, to the patients in real life. So yeah, very exciting. And you will be, your presentation, just to remind people, it's going to be on the Wednesday, November 23rd at Therapy Expo in the STA Theatre at 3:15 p.m. And there's other ones you're doing as well in different parts of Therapy Expo. Do you know offhand?
I think I've just got one more. I'm pretty hectic around that time, and I'm glad you reminded me of the time. I've in the Therapy Expo that day, I've got another one. I think it's around about just before 1:00 on whole body vibration. So it's, again, another thing that what I'm passionate about is bridging that gap. We know that whole body vibration done correctly with the right parameters, with the right devices, is very efficacious for neurological patients, for load compromised patients. But what's happened is we can buy these crappy little machines off Amazon that shake your cellulite off, and it becomes this new next fad, which is poo-pooed. But again, it presents another adjunct to rehabilitation once we understand the fundamentals. So yeah, I'm really excited about that one, and of course talking about the critical differences between kind of force production in the STA theatre, strength and power, and rate force development.
Fantastic. We'll have a little chat about that shortly. But Mr. James Chapman, been sitting there patiently. No stranger to the show. You've been on a couple of times as well, and this is your first time Therapy Expo, which again I've said I'm so excited about. I'm so glad that you're coming along to chat. Again, for people who aren't aware of you and what you do, give us a little 1-minute elevator pitch.
Okay, in 1 minute.
Well, 59 seconds now.
Yeah, so I'm a sports massage therapist and yoga teacher and yoga therapist. I've been doing that for about 20 years now. I'm also a mental health trainer. I've got my own business all about the mind, and I do mental health first aid trainings. I'm also an associate trainer for a large mental health charity, doing similar in a lot of their mental health products. And I got into all of this through lived experience, really. Poor mental health myself. And actually, almost 21 years ago today was the last time I had a drink in the car park of the Priory at 7:30 p.m. on the 27th of November 2001. So, massage is something that massively helped me with my mental health. Exercise was, so in that time, I've worked for many mental health charities, drug rehabs. I've taught yoga for the NHS. I've done massage for mental health charities as well as other stuff, working with athletes and just general population. So I think that's at me. Yeah.
That's good. Ding. We've got to the next floor. Fantastic. No, that's a great summary. I appreciate it's tricky to say everything you've done in a minute, but it's so interesting on a couple of reasons for you, and I imagine you're living in a really relevant time because on the one hand we've got now a change in attitude towards massage because there has been for a while now evidence that we don't know exactly how it affects people, but we do know that it's been shown to alleviate depression and anxiety, so it obviously affects the nervous system in some way, and there's some good quality studies on that. And then also we're living in an age which is full of anxiety and depression for one reason or the other. And it was really fascinating to hear the advice you were giving to therapists in the other episodes we've had you on the show, just making, because therapists suffer, and we'll talk about that shortly as well, how important it is for therapists not only just to know how to recognize red flags with their patients, but also to notice red flags when they're about to kind of go off the rails a little bit themselves, and to keep an eye on, to prevent it from happening in the first place. So it's going to be great to have you along to Therapy Expo. Really exciting. You just to talk about what you offer, because again, we've had a few people from the STA have been on your courses. It's mental health first aid at work, isn't it? Abbreviated to MFAW.
It's mental health first aid. So rather, it's a mental health first aid England product that I teach. So what it does, it gives people the understanding of common mental health conditions, signs and symptoms, and most importantly, how to intervene, because mental health services are generally set up for crisis. So nothing happens until something is really, really wrong. And mental health first aid gives you the ability to not just signpost, because it doesn't teach you to become a professional, a diagnostician or a clinician. It's very clear on that, but it does give you the ability to spot the signs and symptoms, to be able to have conversations, to be able to signpost people to the appropriate professional help, but also to support them with signposting, because services are really stretched in this country. I've been going through some stress myself recently, so I contacted iCope, which in Islington, where I live, is it's part of IAPT, which is Improving Access to Psychological Therapies, a government initiative set up in 2008. Very good to get people into talking therapies quickly. Islington, 9 months. There's a 9-month waiting list. So I was just like, thank you. They gave me lots of other sources where there's, low cost or other therapies available, but that's kind of where we are. And, a clinical response to mental health is medication, talking therapies. Really, I think we need a community response just because of the times that we're in. And really, it's everyone. Mental health is everyone's business. And just by asking a question or listening, and then signposting maybe, or even just listening and saying, thanks for telling me that, we can have a really profound difference to people's well-being, and in these days it's just so necessary.
Fantastic, yes. And for people who want to hear more about the work James does, I'm just going to put this up on the screen. You need to head along to allaboutthemind.com, and there again you'll find loads of interesting information and details on how to get on courses and to contact James. Definitely worth a visit. And also, of course, if you look through the back catalogue of STA podcasts, you'll see a couple of episodes there where we've talked to James as well, as indeed we have done with Dr Claire Minshull as well. It's all there for you to listen to if you want some more information. James will be in the STA Theatre on, should I get this right? Thursday, on the Thursday, November 24th, so the second day at 3:30 p.m. So it would be, I think there's so many. Have you seen the program for this year? It's just ridiculous. I mean, ridiculous in a good sense.
So I was going to say,
no, not ridiculous.
There's these jokers coming along.
Thanks, mate.
Yeah.
It's not ridiculous in like 2016 program. It's just ridiculous in the quality that they've got this year, because for the first time, I think this year, they actually organised a committee of different organisations involved in soft tissue therapy and different kind of, and they said, right, who should we be listening to, as opposed to just selecting people according, I don't know how they did it before. So they really had some interesting debates. Gary, founder of the STA, was involved as well, and other people in different organisations. And the result has been I think I got something like 84 different presentations going on across the 2 days, but it's like people are getting anxiety just from, I can't see everyone. But it's kind of cool because, as we said before, you haven't got to see everybody, because sit down, have a cup of coffee with someone else, do some networking, and you can just find out from other people who they should be looking up, and it's going to be really cool. I'm really excited about it. So good. We'll have a little bit of chat about what your presentation, mental first aid at work. Why do I call it mental first aid at work? I mean, that's what I call the presentation, but it's MHFA, isn't it? Mental
first aid.
So we'll have a little chat about what that's going to be about shortly. But remember, people, if you've got questions for either of our guests, Nikki Mansfield has put up here, wow, happy 21st anniversary, James. Amazing achievement.
Yeah, thanks.
Indeed. It comes from everybody. And Becky Carroll says, looking forward to seeing both James and Claire at the Expo. Yeah, it's going to be great. So, Claire, let's go back to you. I'm interested in, well, I kind of know, because there is an episode where you did with Mike Grice, I think, about critical differences between strength and power, but you've got half an hour. It must be so tricky for professionals like yourself who've got so much information you could give people. But what are you hoping soft tissue therapists who come to see you for this presentation take away from it? Maybe put it that way.
Well, I think what's good about the STA Theatre is it's quite intimate, isn't it? So we can have a better dialogue with people. So I could stand there and give you a 30-minute kind of lecture, or I could give you, my intention is to make it a little less formal and structured and have opportunity for questions, because I think that's really important. So that there's some key things that really differentiate between strength and power, and actually power and rate of force development. But we can cover that a little bit. It's about force production, and what do we need most, when do we need it most, what types of patient groups, client groups need different types of stimulus to train these things, because I'm sure everybody knows specificity. We need to just tailor our interventions to make sure we're changing what we want to change. But then everybody's going to have slightly different thoughts and questions. So, I think those two things, to establish the critical differences, is one or two very quick wins that you can achieve by just changing the parameter of it could be exactly the same exercise, but done in a slightly different way will give a different stimulus, or optimize a stimulus to explosive force production or maximal force production. And then the opportunity for questions and applying it to different groups. So I think that's something I think is important, and I'd like to make sure that there's the opportunity for that, which you do in the way that you've set it up. So it's great.
It's fun. It's cool. And the great thing about it is quite intimate, because it's a smaller stage, but also what I really enjoyed seeing last year is because it's not tucked away in a separate theatre with a curtain, you get traffic passing by. and people kind of stop and look. And obviously all of our speakers are really engaging and really passionate about their job and really nice people. So before we know it, you've got a bottleneck where people are kind of going, excuse me, mate, excuse me, because they're stopping and sitting down. It's like some kind of hippie convention. It's like Woodstock. In a good way. It really
especially if you bring stuff to throw at people, at their freebies and puppets and everything. Come see me.
Exactly. But it's really useful. And I mentioned this before because you will get people who haven't chosen to watch you. They just walk by and suddenly you've got their attention, which I think is what learning's all about, isn't it? It's nice to have your fans and the people at the front adoring you and swooning. But you really want to get through to people who don't know you. Yeah, you do. You know, you've got your fanboys there at the front with the t-shirts, Claire Minshull t-shirts. But it's really nice as an educator to have people who go, oh, I've never heard of you before. What are you talking about? And that's what the whole convention's supposed to be about, isn't it? To bring people. So it's going to be great. STA was, what was this? STA was jumping last year, and Claire was talking.
Jumping. You're the best. I remember the whole NEC was right.
It was just, we were told to turn it down and try and control the crowd and everything. Yeah. But anyway, no, it's a really good, it's really exciting. I'm interested, could you maybe, and I know I'm putting you on the spot, but can you maybe present a scenario where maybe a soft tissue therapist, whether it's sports massage or maybe not a graduate, has got a client or patient, and they are missing that spot where they haven't understood the critical differences. What you mentioned a tweak maybe which could change the outcome. Can you give me an example of maybe?
Okay, so I guess we roll it right back when you're seeing that patient, that client for the first time, second time, third time. What I hope happens, you start to develop a plan of what you want to focus on. What are the deficiencies in your view? And we could have a whole discussion on how you identify those. But let's say you've identified that, a couple of things need to be worked on, and maybe more. Then you start to prioritize how to address them. What should you do first? As we always say, if you try and do too many things at once, you'll end up doing nothing effectively. So establishing that hierarchy of importance, what's most important. In my view, it's always a strength first approach because strength is so often overlooked and done improperly. So if they're deficient in strength, then, that's the thing that you need to focus on, which is high intensity efforts for very few repetitions. So go to my blog, you can find out how to do that, but it's 3 to 5 rep max. You're really failing at that 5th repetition. It's that difficult, done with proper form and safely, right? Now, if that individual has, in your view, sufficient strength, and again, we can have another whole discussion on how much is enough. And you're thinking, actually, it's more about the explosive force production, how to express that force quickly. So it might be, a runner. You've developed the plantar flexion strength, the capacity, you've topped up that fuel tank, but now we need to learn how to express it a little bit more quickly. Then again, very similar exercises can be done with a similar weight, maybe slightly lighter. And there are all manner of ways to train explosive force production, which is effectively rate of force development, which is actually externally measured as power. And the key difference is the intent to perform that exercise explosively. And that's where that word becomes really useful, because I think everybody's got an understanding of what explosive means, and it's not really open to that much interpretation. So to do that exercise with explosive intent, and that is, if there's one thing that differentiates between the two, it's that the explosiveness of that action. And that then you can modulate the exercise with resistance, with the type of exercise. And if it's a heavy weight or a heavy resistance, if you were to measure or film the velocity of movement, clearly it's not going to be as fast as a lighter weight. And again, there's a whole avenue of velocity-based training, but the quick win is that intent. And it doesn't really matter, how quick something is if you're just looking to improve that capacity. If you're going down the avenue of velocity-based training, you're probably well into kind of strength and conditioning and performance, and that individual not be anywhere near kind of injured or in the rehabilitation phase. So intent is the difference, really, and then we can modulate from there.
Wonderful. Becky Carroll has said, I highly recommend Claire's strength training for therapist course. It's a game changer for therapists.
Thank you, Becky. I'll give you. I'll pay you after.
Okay, you got your fans. Yeah, and I think in my experience, from receiving emails and chatting to other therapists, it is a confidence issue, isn't it? It's like, oh, strength, and it's not having the confidence, not having enough tools or ideas or a comprehension of what you're supposed to be doing that make people shy away from maybe experimenting, from tweaking, from thinking a little bit, what am I trying to achieve with this exercise? What are they going to do with it? So I think that's the feedback I've had from your course. It encourages people to actually think a little bit more about what they're trying to achieve.
It becomes easier then, you're often, it's, if you see somebody for the first time, you're like, bloody hell, I've got all this stuff that I need to address and change. I kind of take a breather, write it all down, and then put them in an order of importance. And when you put them in an order of importance, then, thanks, Stevie, then you can think about how you intervene to improve those, because one exercise is not going to do it all for you. It's okay, strength first, high loading, low repetitions, lots of rest, change your exercise to accommodate clinical restrictions, train the other side, do eccentric first, be explosive, whatever it is. Then the next thing, maybe it's cross-sectional area, or maybe it's power and explosive strength. Okay, now we transition and we do the other thing. Doing it all at once, even in the same week, is not probably going to give you the same benefits as if you do one thing consistently, get a kind of top that fuel tank up. Because remember, you're going to be dealing with these individuals that are likely quite deficient in all areas or many of these areas, because they're, you're working with them.
How useful do you think it is? I've asked this before, but I think sometimes therapists who have never done strength training themselves, really, and there are a few, maybe they come from more of a, how should I say this? I can't say yoga background, there's plenty of, because I've got, someone in the room here would absolutely slap me around the face if I suggested that yoga people aren't strong, because I've seen the photos, mate. Wow. But from maybe a sort of exercise which is more kind of all maybe hatha yoga or more kind of meditative, or something which hasn't involved lifting heavier weights, that gives them less confidence. Do you think it's important maybe for therapists to understand what it feels like lifting a heavy weight, to be able to then hand it out?
Yeah, and as Stevie and Becky et al. will kind of be able to provide testimony for, even in the online courses that I teach, I give exercises for individuals to go away and experience this. Because, and I was just working, I take on very, very few individual clients because I'm so busy, but yesterday I was working with an age group triathlete, 50-ish, 53 I think he was, needs to do some strength and conditioning to improve performance, be a bit more resilient to injury, etc. And as I was describing to him, he's never done any resistance type exercise like this before. He's done the runner's strength training, which is just write anything down and that will be in runner's world anyway. So I was describing to him that it will feel very, very different, and you don't experience those challenges usually in normal life. So that feeling that you get when you're doing, I don't know, let's say 12-ish repetitions, it starts to burn, develop the lactic acidosis, so the hydrogen ions into the musculature, and it burns and, impairs contractile capability. You might feel that or have felt that quite regularly in your life by doing things that are reasonably heavy for a long period of time. It's not often that you lift something in your own in life that you could only do 3 or 4 times. It's that heavy. So therefore, we've got nothing to benchmark this against. And we, without fail, every course that I teach, everybody that's not done this before grossly underestimates what they can do, how strong they actually are. And then by doing it, you one, experience what it's like, so you've got an understanding of that. It kind of almost generates a new vocabulary for you. And 3, it makes you understand what everybody else is capable of. So if you're underestimating what you can do, imagine what you're projecting onto others as well. So it's hugely, even if you don't enjoy doing it and do it as a part of your own training, it gives you an idea of capacity and what people and you can kind of work towards. And as we get older, that's the thing that starts to decline rapidly, and we don't feel it.
That's really interesting. It's like I always say, sometimes I don't wish kind of injury on anyone, but sometimes it's kind of useful if you're a therapist and you do have to go through that rehab thing, because you recognize suddenly the fears, the catastrophizing, what it's like to suddenly not have strength, not to be able to do a single heel lift or something off a step, you know. And unless you go through that, you don't understand what you're asking of somebody who is in that stage of rehab to do what you're asking them to do. And it's kind of impossible to kind of think of all the different factors which could stop them from doing this exercise unless you know what it's like to be in their shoes. So it's kind of cool. If you haven't been exercised for a while, basically, soft tissue therapists, go out tomorrow, do a sprint without warming up or something. Just know what it's like to have a proximal tendinopathy in a hamstring. Just so you know what it's like to feel pain in your bum.
There's commitment.
There you go, or Achilles tendinopathy or something like that. Just so you can actually know what it's like when you hand out these exercises. It's actually, I did see somebody here, Sabrina here, has said, I'd love to do the course in the future.
Brilliant.
And that's reminded me actually, because I think in the STA, I think it was in the STA Open group today, you did put details. I don't think I've got the link on me, but if somebody could go to the STA Open group. Was it in the Open group? I think it was. You've got a course coming up, or something?
Yeah, so brilliant, Sabrina. If you go to getbacktosport.com and sign up for the free S&C download that's at the bottom of the page, or every blog, you'll get notification when the next enrollment is, it'll be the end of February for that particular course. There's another course which is a power rate of force development course, which will enroll between just before then. But yeah, there's another webinar that I'm running next week, which is the advanced kind of topics. So when I spoke about the cross-education effect, mitigating DOMs and muscle damage, kind of maybe not training strength and endurance together in rehab, and what effects that might have. So there's a free webinar that I'm doing next Tuesday and Wednesday on those topics. So, do sign up for that if you're keen. There's a link in the open group. It should be in the members group as well, but I put that in there today. But if you want to ask me any questions, just drop me a line, get me on social media, whatever, if you can't find it.
Brilliant. We'll make sure that link goes into the show notes, and I'm sure that at the moment one of our trusty Live Lounge people is flicking through the STA pages, and they will copy that link, won't they, somebody, into the comments very soon. Magic, right? That sounds fantastic. So, like I say, Dr. Claire Minshull will be in the STA Theatre on the Wednesday at 3:15, and also presenting, I think, 1 o'clock. He said, in one of the other theatres. Have a look at all this information is on Therapy Expo website. It's quite nicely put together. You just scroll down, you can see what's happening all the time. So it's all there. We look forward to hopefully seeing somebody in the STA Theatre. Gary says the details were in both groups. Fantastic. Thanks, Gary. Right. James, your first time at Therapy Expo. The floor is going to be yours. A load of soft tissue therapists with jaws open, confused kind of look on their faces of what's this all about. What are you hoping the people that come and see you on the Thursday at 3:30 are going to take away in your half hour?
I think what I'm going to be doing, because obviously there's lots of as you said, there's lots of actually quite good quality studies on the effects of massage and mental health. But, rather than going into that and stats around, poor mental health prevalence of it with athletes, I'm going to talk a little bit about, I might talk about that a little bit, but also just the prevalence of it in the general population, and actually how much mental ill health there is around. I think there was a study in 2019, the UK Anti-Doping Agency did one, and 34% of gym goers knew about people taking iPads, image performance enhancing drugs. There was another study in 2018, and they think there's about 1 million people in this country taking them. And whatever reasons some people might be taking them, I know from my experience of having clinics in gyms and stuff that it's a lot. And that kind of behavior is often, there could be some body dysmorphia going on. It's really self-harming behavior. So the point is that mental health is prevalent. You know, people, my experience as a therapist anyway, people come and see me and they might have some shoulder dysfunction or something. You get them on the couch and then they talk, you know, they relax, they talk. Therapists will, you know, there's a lot of vicarious trauma that can come along from listening to this and getting involved in it. And I'm very clear on, you know, one thing I want to make clear for people is how to be able to support people to do your job as a therapist, but to have clear boundaries so that you're not getting emotionally entangled in what someone might be saying and giving the well-meaning advice, which is outside of your scope of professionalism, which, you know, you might go home and be, oh, should I have done that? Oh, you know, and I think that can, you know, that can kind of build. So I want to give people tools to be able to do that, to be able to to be able to listen non-judgmentally. I always ask people, can we be non-judgmental? And I'm always interested in the answers. If anyone wants to say, answer that in the chat, can you be non-judgmental? Yeah, the answer is no. You could try though, because it's normal, you know, to make judgments and stuff, and actually to be able to listen to someone, to be able to give them that space without crossing any boundaries. And to be able to thank them for saying that, and to be able to signpost them to professional help, the appropriate professional help, I think is really, really important. So I'll be giving people some listening skills, talking about stress as well, because stress is something that is a huge factor. It's a risk factor, and you know, for many common mental health conditions and suicide. We're under a lot of stress at the moment. Athletes are under stress. Everyone is under stress, you know, and when you can't exercise, when you are, you know, when you've got some injury or something like that, that's extra, you know, on top of that. So, you know, to be able to, I think, to recognize the stress that you have in your life, to be able to name it, to be able to have practical tools to deal with it is really important. And I think for the therapists themselves, so I'm going to give them a run through of the stress container, which is a way of doing that. Because, you know, as therapists, I mean, I've just recently had a clinic that I've worked at for many years in London. Prices have gone up. They've cut a lot of staff. The last 2 months I've had problems with pay. They've been underpaying me and just making a complete mess out of everything. And then there's the whole people tightening their belts and doing the whole social media stuff, and, you know, dealing with all your life stuff as well as trying to fix people. And I think, yeah, I know from experience, you know, stress can soon build up, and then, you know, before long it's overwhelming. So that's what I'm going to be I think giving to people, and finding out what's, you know, what people have in their clinics and their experience, and how they cope with that.
Wonderful. Yeah. And again, because like Claire mentioned, it's in a quite intimate, easy for people to ask questions. It's not at the back of an auditorium where you can't even see the hand. People will be around and seated there, so it'll be really interesting for people to ask you questions. Leslie Campbell has just said that she's only non-judgmental at work, judgmental Mary in my real life. So thanks, Leslie, for your honesty, as always. Yeah, it's. I'm going to ask you a question. I mean, I don't know if it's a stupid question. I tend to do this while I'm listening, just something comes in my mind. But things are going to get worse, aren't they? We're talking about how bills are going up and heating and everything, and social media is still kind of. I mean, for my sins, had this idea to join TikTok the other day because I heard other people are doing it, and it's kind of a good way to help get the message out. If lots of people are there, and I've got loads of, for example, you guys to try and reach people, then TikTok's kind of being used, and it's got high viewership and that. Oh Jesus, why did I bother? Why did I go on there? It's just depressing, man. It's just got. I thought Instagram was bad in terms of setting false expectations and taking away time, and the algorithms are so clever It's just as soon as you watch something for a few more seconds, that's it. You've got 5 or 6 more videos exactly the same, just taking your time away. And it's just so much of it. It's just something I never asked to see. I promise you, half the things which I spent 2 hours looking at the other day was not stuff that I asked to see. It was just stuff that's chucked your way, and it's shocking. But my question to you is, it's not a pretty picture, I don't think, without sounding too cynical and depressive, but if you could wave a magic wand and help turn the tide so that issues with mental health, anxiety, depression started getting better, how would you do that? I mean, it doesn't have to be a real thing, but where do you think the state we're living in of ever increasing stress and anxiety and expectation, how could you turn it around? What would be the quickest way of doing it, if you had a magic?
I think we're at the point now with mental health where it's like the tip of an iceberg. We're at the point now we've got awareness. We need action. We need the government to spend money. We've had years of austerity. I don't want to get too political, but it's true. We've had lots of services cut, massive waiting lists, a lot of people in poverty, a lot of people relying on food banks. It seems like it's going to get worse. So they need to spend some money. The government needs to spend some money. While we're waiting for them to do that, we will need to get involved. Mental health is something that we all have. It's something that we all experience. And mental health first aid training, like I said, it doesn't teach you to become a clinician or a diagnostician. You understand common mental health conditions, but you're not there to diagnose. And really, it's about having conversations before it gets to that point of crisis. Knowing what to do when there is a crisis is fundamental as well. But there are so many interventions along the way, that we can get involved and talk to people. I do a lot of youth work. I do a lot of youth mental health first aid. I work with CAMS teams and, that's child and adolescent mental health services. And I did one recently for the police and lots of different people. And I think there's for example, self-harming behavior, people getting into fights, young people getting into fights, young people getting into substance abuse, people having, risky kind of sexual behavior, all this kind of stuff, which is often looked at is self-harming behavior. It's not just cutting and burning and all those kinds of things. That's self-harming behavior. And this is often behavior which is looked at, it's just a behavior, they're bad, they exclude them, do this, do that. And 75% of mental ill health starts before the age of 18, 50% by the age of 15. So I think I think we have to get involved. The government need to do something, but we as people have to start talking about it. Mental health should be, how's your health? If I say, how's your health? Everyone knows what their 5 a day is. Everyone knows our health, physical, great, yeah, good. If I say to people, and I do every day, what's mental health? If I say mental health to you, what does it mean? More and more, I have people saying mental health is fluid. It can be good, it can be bad. It's about coping, it's about resilience and positive stuff. But a lot of people are still, if I say mental health, they're depression, anxiety, schizo, psycho, bad, something like that. If I went up to your average person on the street and said, how are you doing today? How's your mental health? They'd be like, why do it'd be like, why are you saying that to me? It would be, whereas it should be a normal thing.
Okay. Yeah. So communication, conversation. I forget, maybe somebody in here, you reminded me, there is an STA member, for the life of me I can't remember his name, but he set up a new podcast. One of you guys will know, maybe throw it into the comments, but it's a podcast, I can't remember the name of it, designed to help guys. It's kind of aimed at guys, this particular podcast, to speak out and talk to each other. It looked really good. I can't remember the STA member who set it up, but he's really passionate about it. Maybe one of you could look it up. I'm sure it's a well-known person in the STA. It's gone. But I suppose, conversations, communication, and that's what your course does, I guess, is not to diagnose anything like that, but just opening up the conversation and referring on where necessary.
Yeah, often it's about having someone's back. I had a relative who's very ill and was hospitalized, and I called called her up, said, "How's therapy going?" And I haven't had any therapy yet. And I'm like, "What?" And she was waiting for a specific type of therapy. And I just Googled the area that she lives in, found charities that were there, made some phone calls, and got her some talking therapy quite quickly. So it's often doing that. It's about, because signposting is one thing, definitely, but being able to support someone, because, I think when you're going through that, you might not often know that something's wrong or that there's help available, because there aren't conversations around mental health. Often people think this is something I have to live with. There's often a lot of shame around it, a lot of stigma, and it doesn't have to be. It doesn't have to be that.
Very valuable. And as massage therapists, we said this before in other episodes, people, if somebody's giving you permission to kind of touch them physically, and they're taking their clothes off in front of you and lying down and not seeing you and trusting you behind them, sort of thing, then that's kind of already opened a door of potential communication and trust, and that whole kind of empathy and that kind of therapeutic alliance. So it's a perfect environment, isn't it, if you're trained and you know not to go too far, but just to open the door slightly and to recognize and signpost and stuff. And I think our profession is really well suited to be able to help this problem, and especially when people are coming to us in pain, and we're inviting them to open up during the subjective. So brilliant. It all sounds great. Becky Carroll, thank you. I knew you and let me down. Yeah, Ryan, of course. Ryan Smith has started a podcast which is called Let's Be Frank. I haven't had a chance to listen to it yet, but the feedback I've had so far and his excitement is amazing. And it's kind of, like I say, it's his particular podcast is aimed at guys getting together and talking and overcoming the taboo and the stigma attached to not talking about your feelings and stuff like that. So yeah, check it out. Ryan Smith, Let's Be Frank. I think I've seen him talking about it. Just look up his profile on Facebook, Ryan Smith, STA member. You might want to have a little listen to that. Right, okay, it's 8:55. So yeah, both of you, Therapy Expo this year. Claire, to you, have you noticed a change in kind of the general soft tissue therapy world in terms of education or openness to change or openness to evolution? Do you think it's getting better, or is it the same?
With specific to Therapy Expo, or generally?
I think in general, like the crowd we're going to get. I mean, Therapy Expo gets thousands and thousands of people going through across the 2 days, and I'm wondering whether we can generalize and say that the average, well, that's a ridiculous word, but the average therapist coming through, do you think they're better equipped these days with regards to their knowledge of the strength, for example, your field, or do you think there's still a lot of work to be done? Or
I think so. If I take an overarching view across people that I teach, the baseline level of knowledge is better. A good example is that I used to ask, I still do actually, but I ask a start of any course that I do, if we're talking about strength, what's the definition of strength? And even up till about 3 years ago, I'd get 4 to 5 different definitions of what strength was. And whilst they're broadly, the definitions might encompass aspects that have, kind of informed by strength, it's not what strength actually is. The implications being, therefore, if everybody's got a different definition, we're all going to do different things to try and to make it, improve it. So that has definitely changed and improved over time. And I think that translates into other things as well. Unfortunately, I don't think, or maybe fortunately for me, it's not because the baseline or basal level of education has got better consistently across the board. I think people, hopefully, including myself, we're speaking about this a lot, these types of things a lot, quite loudly, prolifically, and offering an evidence base for it and a strategy to incorporate into rehabilitation, strong rationale, and then a further evidence base, rather than it being just hearsay and opinion and kind of bro science, if there is such a thing. So I think therapists are doing a really good job of educating themselves via some of these channels. So I think, yes, that levelness of education is opening up. I think and appetite for that is opening up, which is great.
Yeah, that's good. I like that. That's positive. I feel like I kind of brought the tone down when I was talking about TikTok and getting all depressed and stuff. But it's true. I think I
not
agree
on
with
TikTok
you.
yet, so
don't bother going there. I forget. It doesn't matter if there's the amount of podcasts on there or whatever. It's just stay away from it. It's the devil. It's horrible. It's just not worth going in there. I don't know. Anyway, so yeah, no, I agree. I like that. I think that there's more of a thirst for kind of more evidence-informed approach. It's not so shocking now thinking you need to evolve and saying the same things you did 5 years ago just doesn't work. And also I think that's a really healthy foundation for ultimately people, the general public, if they've got therapists who aren't afraid of saying I'm not quite sure, who aren't afraid of moving. That's what, and working together, having a multidisciplinary approach, not being afraid to hand somebody to somebody else when you think they can help you better.
That without fail, you think about the practitioners that are slightly more experienced, that are confident and comfortable in themselves and not knowing. That gives you, as somebody who's receiving care, if you put yourself on the other side of that, if your therapist or whoever has always got an answer, and you can tell if they're fudging it a little bit, you just don't buy in, do you? But actually, that's a really good question. My thoughts around this are, so when I do it at Therapy Expo, that's a good question. What do you think?
I'll let you go know now.
Yeah. But, if you offer your best opinion, but actually, I really don't know the ultimate answer to that. I'm not sure if there is one, but, you've got confidence in that individual and in what they know, what they perhaps don't know. Maybe they're going to go find it out. And there's nothing wrong with that. There's nothing wrong with that at all. I think not that it's wrong, but it's disappointing when there's no, when you're in positions of authority like this and ability to help people, the lack of desire to inform yourself and keep up to date, or indeed sit back and, I've heard it said before, nothing's going to change. This has always happened. Ran on the field with physios with sponges. If we still did that, anyway, I'll not go down that avenue. So yeah, I'm privileged to be able to talk to people that want to listen and listen to me in particular.
So modest. All my guests are so modest. I love it. Don't change. It's great. You're privileged, honestly. James, in your profession as well, I imagine it's not good to think that you've got all the answers. I mean, Freud tried that. We know how wrong he was in a lot of respects, but it must be in your profession it's dangerous if you're going to see a clinician who thinks, oh, you've got this. This is textbook. In mental health, I'm sure that there's a great example of where everyone's different as an individual. And
yeah, for sure. It's and that's why with the mental health first aid training, it's very clear to understand your boundaries, your limitations, and not to try and diagnose. When you get into it and you look at the different mental health conditions and the symptoms and stuff, they're so interlinked, and that's why it's a rabbit hole you just don't want to go around. So, being able to allow someone to speak and say, thanks for sharing that. I'm a sports massage therapist. This is my scope of practice. Have you spoken to so-and-so? I think you should do that. And then when you do your follow-up for whatever, spinatus or whatever's going on with them, just check in with them and say, how did you get on with your, GP or whatever. And obviously when it comes to rehabilitation, there's a lot of, there's stuff that's outside of the, of whatever sport that's going on. And if it's affecting poor mental health, it's affecting relationships, if it's affecting their sleep and stuff like that, it's going to have a huge thing. I do Olympic lifting actually, and just recently I started hitting my personal best in my warm-up. And what happened was she's now 4-year-old daughter, she was 3 at the time, she started sleeping almost through the night. So I wasn't being woken up 4 or 5 times a night, which I've been done from all my children for the last 9 years. And suddenly I'm sleeping and I'm hitting my personal best just in my warm-up because I'm getting some rest. So obviously, physical and mental health are intertwined, and I think it's really important to have those boundaries. I just want to say, Claire, you sound, I've been so enthralled listening to you, and your course sounds absolutely fantastic. And I actually went to an osteopath about 7 years ago when I was lifting. I had a sternoclavicular issue on load when I was doing snatches. And this was, I went to this osteopath, and Harley Street works for a top Premiership football team, well, not a top one. And she's just like, why are you doing Olympic lifting at your age? I won't tell you what I said to her. I used the word beginning with F, and it was actually that. I was, my previous personal trainer was, I was doing kind of like, it's very much more like CrossFit type stuff. And then I went to someone else and saying, you know, low reps, high load, 3 or 4 different exercises, 3 or 4 times a week. And that was amazing. So yeah,
got you. We need a coffee. I'm enthralled by what you're saying as well. So we'll hopefully be able to see each other at the expo.
Yeah, definitely, be lovely.
Okay, guys, I've kept you for 4 minutes too long. Thank you so much for joining us. Thank you also. There's a reminder here. It was, there we go. Yeah, Ryan Smith is, I knew why I knew Ryan Smith. Ryan Smith is actually one of the STA regional reps. He's the regional rep for the East of England. God bless the East of England. So he's going to be at the STA with the STA team at Therapy Expo. So that's a great segue. So if you're interested in the podcast and the conversations that Ryan's generating with his Let's Be Frank podcast, then yeah, Ryan will be there at Therapy Expo with the team at the stand there. Brilliant. Thanks for letting me know about that, Ryan. Sorry about forgetting your name, Ryan. Apologies for that. I've just got so much to think about. You can appreciate with these 2 people in here. I've got to think of so much. So there we go. Right. Fine. Thank you so much for joining us, people. Dr. Claire Minshull, we mentioned your course is coming up. We'll make sure that goes in the show notes. But like you said, yeah, go to your website. Let's just bring that up for people who like a visual. There we go. There we go. So get back to sport. Beautiful. Look at that design.
It's good, isn't it?
Love that. Yeah.
I'd love to say that's all my work, but it's clearly not. If anybody's ever seen me try and design anything, I signed it off. I did sign it off. It was kind of my idea. Yeah.
Yeah, lovely website. Getbacktosport.com. Loads of information on there. Just sign up, like Claire said, and you'll get information about all courses that are coming up. And if you've been interested in what James Chapman has said today, as you should be, then head along to allaboutthemind.com. Also a beautiful website. Thank you very much.
Yeah, my wife did that actually.
Very nice. Yeah, love it.
And you can have 50% off of any of my upcoming courses. You can use code STA50 uppercase at checkout.
There you go. Look at that. Another person who can't stop giving things away. Honestly, that's very kind of you. Yep. So all this information will go into the show notes, and like I say, yeah, allaboutthemind.com. And if you want to see these guys at Therapy Expo, then just to repeat, Dr. Claire Minshull will be presenting Critical Differences Between Strength and Power on the Wednesday at 3:15, and James Chapman will be presenting Mental First Aid at Work in the STA Theatre on Thursday, November 24th at 3:30 p.m. Next week on the show, our last episode before everyone up to Birmingham is going to be with some guy like James. I think he's a bit into endurance. I think he's a physio.
Not him.
No, I know. Well, I wanted something traditional. I wanted something, old school. So
that'll be a good one.
Mike James will be joining us, the wonderful Mike James, the insurance physio, next week. Who I've had the joy of knowing, and he's spoken on One Chat Live conference a few times, and he's definitely been at the conference many a time. So he's going to be coming, giving his thoughts on this year's lineup and talking about everything Therapy Expo as well, just to get the excitement if it's not already a fever pitch.
Great.
He's great, isn't he? Oh, Mike is great. So yeah, he's going to be around next week at 8 o'clock. So if you're listening to the podcast and you want to join live and kind of get to know the people that have been in the live lounge, know something about the STA maybe, then just put it in your diary now. 8 o'clock on Tuesday on the Sports Therapy Association YouTube channel. James, Claire, thank you very much for giving up your time.
Thank you, Matt.
Pleasure. Very nice to meet you as well, James.
Thank you. And you,
I'm going to have to be chasing and making sure you're not talking when your presentation's coming up.
I know.
We're talking about CrossFit and weightlifting and stuff, and I have to separate you. You can see this coming. But yeah, really excited to spending time. It's going to be really nice to have you in person. So there we go, people. Thanks for joining us live again. And hopefully we shall see some of you. If you listen to the podcast, then leave a rating, leave a review. That's really important. We're talking about getting good and quality information out there. Put something useful in Google so it appears near the top instead of just all the crap that appears near the top. So leave a rating on Apple, in particular Apple Podcasts, and this episode will be there when people look up mental health or look up strength and conditioning. You've got to leave ratings and reviews, otherwise Google's not your friend. So please do that if you listen to the podcast. Otherwise, take care of each other, and hopefully we'll see some of you live next week. Good night.